Thank you very much, Dr. Tirani. Good afternoon, all professors, deans, and all the audience. Today, I would like to present my research. I changed a bit my title. Okay. Before we go further, I would like to introduce myself. My name is Hazreen, and you can just call me Hazreen. I'm from Department of Global Health and Socio-Epidemiology from the Kyoto University School of Public Health. Okay. So this is my title, Qualitative Inquiry into Social, Cultural and Religious Factors Related to Childhood Vaccine Hesitancy Among Pregnant Women in Rural Malaysia. So as a rising public health researcher, I involved since the beginning of this research activity. So from the designing the research and the protocol development, and then initiate a collaboration, especially with the Ministry of Health Malaysia, and also with the Vaccine Confidence Project in the London Schools of Hygiene and Tropical Medicine. After that, I also involved in the administrative purpose in obtaining the ethical approval from the Graduate School of Medicine, Kyoto University, and also the Medical Ethics Committee in the Ministry of Health Malaysia. Besides that, I involved in the data collection and further on the data analysis. And I come out with these posters. Okay. So these are the outlines that I'm going to present, which is start from introduction, objective, methodology, results, and later on conclusion and study limitation. So we go to introduction. So actually these photos, I took it from the one of the study site where I conduct the interview. It's in one of the religious school located in Kuantan City, Pahang. So 1.5 million, these figures shows under 5 years children died of vaccine preventable disease in 2015. Vaccine preventable diseases can be caused by the diphtheria, for the example diphtheria, tetanus, pertussis, or measles, and the most contagious is the measles. There's many causes which causing the death for vaccine preventable diseases. One of the most common is due to vaccine hesitancy. WHO, the World Health Organization, has addressed the definition of the vaccine hesitancy, which is delay in acceptance or refusal of vaccine despite the availability of the vaccine services. So, for more understanding, we can see where is the vaccine hesitancy. On your right side, there's a accept all vaccination, and on your right side is a refuse all vaccination. So the vaccine hesitancy means those who are accept some vaccination, those who are delay some of the vaccination, or they refuse some. Or they can be vaccine hesitant if they accept but they're not sure why they took a vaccine, or they refuse but they're unsure why they took a vaccination for their children. Global Vaccine Action Plan has addressed these three key determinants for vaccine hesitancy. The first is convenience, second is complacency, and three is confidence. Convenience means those parents who hesitate because it's too difficult or costly or it's time consuming to get a childhood vaccination. Second is complacency. It relates to parents who hesitate to take a vaccine because they felt vaccine is not important, or they think that vaccine is not severe enough to warrant a vaccination. And then confidence. Those who are parents who are hesitate is due to lack of trust. It's either to the individual or institution, or they may doubt the vaccination itself. It's either because of the safety of the vaccination, side effects, or the content of the vaccine. And part of that, maybe they prefer to choose an alternative treatment or traditional medicine. So these three, any lack of convenience, complacency or confidence may lead to vaccine hesitancy. In Malaysia, the number of parents with children aged below 2 years refusing vaccination has increased. As we can see in 2013, there's about 470 cases, whereas in 2015, it's increased about more than twofold. So it's a big problem in Malaysia. The objective of this study, we aims to explore socio-cultural and contextual factors that influence childhood vaccine hesitancy. For the methods, first we recruit the participants and then we conduct in-depth interview among the pregnant women from the Kuantan district of Pahang. Age of the participant is 18 years and above with their consent. Then later we obtain the demographic information and assess their confidence using the vaccine confidence index scale. So on your right, you can see the vaccine confidence index scale is kind of Likert scale that we use. So 0 means no confidence, 1 is low confidence, 2 is moderate confidence, and 3 is high confidence. Later, the audio recorded interviews were transcribed into words, application, and translated from the local language into English. And then we done a thematic analysis and generate a codes and themes. These are the inclusion criteria and the exclusion criteria for the participant that we recruit. The inclusion criteria is a Malaysian citizen, age 18 and above, last childbirth within 5 years, and able to provide written informed consent. And then we exclude those who are medical personnel, example doctors, nurses, or any medical staff. And then the participant who are unable to speak in local language. During the study data collection, we identified these 3 groups of participants. First, those who are accept, second, who are delay, and third, who are refuse. Those who are accept, we define as participants who accept all vaccine for all children. And the second group is those who are delay. Delay means at least delay 1 vaccination for at least 1 month. And then the third group is refuse group, which is they refuse at least 1 vaccination. The participants were considered as vaccine hesitant if they refuse or delay at least 1 vaccination, or they accept the vaccination but they had answered the VCI scale as 0, 1, or 2. So they were considered as vaccine hesitant. For the result, we managed to interview about 27 participants, which consists of 15 accept group, 15 participants which accept the vaccination, and 6 were delay and 6 were refuse vaccination. And the age range for all the participants is in between 20 years to 39 years, and most of them is, or 17 out of 27 is from the 30 to 39 years old. For the ethnic and religion, most of the participant is Malay ethnic, which is 24 of them is Malay out of 27, and 2 are Chinese and 1 Indian. And then for the educational level, 56% managed to complete high school, and the rest further to the college or university level. For the job status, 52% is employed for wages, 4 out of 27 own a business, and then 9 out of 27 just stay at home with no wages. And then for the monthly household income, 67% has lower income, which is 3,000 ringgit or below. And the rest is from the middle income and higher income. And for the VCI scale, Vaccine Confidence Index scale, only one participant answered there's no confidence. And the rest, 40%, which is 11 over 27 out of 27, answered as has moderate confidence, mean they has a little bit hesitant, and 56% answered as high confidence. Okay, this figure 4 shows a distribution of vaccination status according to VCI scale. Okay, the first arrow, red arrow, shows for those who answer as high confidence, there are from 12 of them accept the vaccination, whereas other 3 delay and refuse vaccination even though they have high confidence. This is the first problem. Second problem is for those who answer moderate confidence or give us scale 2, 4 of them 3 of them accept the vaccination, whereas even though they have moderate confidence, they has various action. They can be accept, they can be delay, or they can be refuse the vaccination. And this is quite clear. So they have only one participant answer no confidence, and they she had no confidence, means she refused a vaccination. So we managed to get 4 teams, 17 categories, and 31 codes. For the result, a conceptual framework, as you can see here, the main themes are divided into 4, which is the yellow circle is confidence, and then convenience, complacency, and the newly identified key determinants for vaccine hesitancy in Malaysia is prohibition. So we go in details. For the convenience, there's 4 categories, shows that give negative influence to the confidence part, which is doubt in safety. Most of the participants did answer. She did not think that vaccine is safe, and then she told vaccine has been told that vaccine is not safe, and the third one told of bad reaction, and other participant told that she had a bad experience, or the child had pain during the vaccination. The second category is distrust in staff. For example, the vaccinator and also health staff. So this is the quote. One of the participants who accept the vaccination, she said, "I'm afraid the trainee nurse makes a mistake. She inject 2 times. My child suffer. It's painful." The third category is social influence, which has give a negative influence for confidence, which they got a bad influence from the famous individual, health personnel, internet, and also anti-vaccine group. For famous individual, one of the participants says, "I got influence from one famous nasheed singer. He reject vaccine for all his children. He announced to public using his Facebook account." And then the preference of alternative. Most of the participants who delay or refuse the vaccines answered is due to hygiene, one of the alternative choice, and then sunnah food, and also traditional medicine. So this participant says that the solution is sunnah food like dates, habatus sauda and honey. Keep hygiene. The disease occurs when we not keep hygiene. We also identified 5 categories which can give a positive influence for the confidence. The first one is trust in government. Second is trust in doctor. Third is explain well. Fourth is belief in effectiveness. And fifth is religion. One of the participants said, I changed my mind after watch Tok Guru's or Muslim scholars talk. He said vaccine is harus or a must. We plan to take vaccine for next child. So this participant, she is refused vaccination but plan to take vaccination for next child. Okay, for the second themes, which is convenient, we identified two categories which can cause or give a negative influence for convenience, which is geographical factor, which they answered too far, and also time schedule, is because of unmatched schedule. This participant answered that my workplace is like 1 hour journey from the house. It's too far. When I reach the clinic near my house, it's already closed. And then the next participant said, if I want to go to clinic for vaccination, I need to take appointment first. Then I should came back later on during the appointment date. It's troublesome. And we identified one factor which can cause positive influence to the convenience. Some of the participants says, government vaccination program is better. It's updated and I prefer to take vaccine at government clinic. So this participant shows high trust to the government clinic is convenient for her. Okay, the third themes is complacency, which is they answer that not needed and awkward after growth. This participant said, I'm not trust the vaccine at that time. I feel that the vaccine is not needed. And the second one, my child is getting bigger. That's why we didn't bring the child to clinic. Can I take a vaccine for my children? I feel a bit awkward to go to clinic. So during the interview, this participant even asked me, can I bring my child to clinic? Okay. So this is a new findings that we get from the field, which is the new themes, prohibition. All these 3 negative influence to prohibition is, first is religion, paternalism, and political influence. Some of them says that vaccine is not halal. Second is prohibited material is used in a vaccine. And third, God is most powerful. This participant said, I'm not hesitate. I just worried. Someone said the vaccine is from urine, but I'm not sure. And then for the paternalism, some said husband decide, husband refuse, and another one is because she depend on her husband. I follow my husband. He is the one who make a decision. Everything about the kid was decided by him. The reason is due to my husband. He is the only one who refused to vaccinate our children. And the last political influence for prohibition is the example is, it is due to political reason. Politic in health, politic in the family. Vaccination program is created by the government, kind of conspiracy to weaken the opposition political party. So that's what we get from the field. So we managed to combine all this in one conceptual framework. Okay. all these categories influence the confidence, and then geographical, time schedule, and government clinic convenient influence the convenience. Vaccine is not needed and outward aftergrowth leads to complacency. Paternalism, religion, and political influence leads to prohibition. And these four factors lead to vaccine hesitancy. So, as a conclusion, we identified that factors contributing to vaccine hesitancy includes confidence factor, convenience factor, complacency, and prohibition. And then for the factors promoting vaccine intake, particularly in Malaysia, it's related to confidence and convenience. So, as a recommendation, we would like to suggest that Muslim scholars can act as a strong influencer, get them involved in a health promotion strategy, and so that the publics can get influence from them. And second is to gain a public trust. It's actually take a longer time, but we can start it from now on, which by providing a genuine care. Is start from the primary health and then later on in the higher institution, and do listen to both parents' problem, not only the mother who brings the child to clinic, but get involved the father also, and anything that they tell us, take them as a serious. And the third is healthcare provider confidence. So maybe we can suggest that by conducting a seminar or continuous education to the health provider to gain a confidence in answering during the vaccination process, and also to make them feel confident in the safety of vaccine that they are recommending during the vaccination process. Our study limitation is inability to generalize the findings as it is qualitative in nature, and it has possibility of interview bias due to scarcity of the study participants, because we do include those who are accept, delay, and refuse vaccination. And before we end, I would like to share you this quote. Never assume what is in the minds and emotion of people, and never forget that they can change. It's from Prof. Heidi, the director of the Vaccine Confidence Project. So, thank you.